reshaping of the face and mind. So what do we see? What do you guys see when you see this? So this is clearly a baby who has a severe cleft lip and palate. And you can see in the bottom right-hand image is this is the repair after we finished repairing this little boy in surgery. Now what you don't see is where I am and the background behind this picture. So this is Vietnam. I went on a mission trip to Hanoi in order to be able to teach the local surgeons there how to operate in some of our techniques that I'd learned in the US. These patients would wait endless months on end in the hospital corridors, waiting for the chance of having their son or daughter have a cleft lip repair. And it is one of those situations which was sad to see when you went there. The hospital corridors just lined with hundreds and hundreds of patients who had travelled hundreds, if not thousands of miles to hopefully one day be repaired, and they would just wait in the corridor until that day came. Well, for this lucky boy, we were in town, and he was next on the list. So we were able to repair this, and his father was a farmer who had sacrificed everything to bring his boy here, and obviously takes time away for all those months from work just to have the chance of seeing their son have a cleft lip repair. So as surgeons, it's a privilege and an honour to be able to reshape the face of this little boy, not only for him to be able to adjust and get back into normal society, but also for feeding, for swallowing, for speaking. Cleft lips and palates can affect every form of function that we take for granted in our daily lives. So the goal was to get him back to a point where he would be able to live his life as normally as he possibly could, without the stigma that people put on patients who have undergone such surgeries or who haven't. And if you walk through the streets of Vietnam, or any other developing country for that matter, you can see countless adults even who have had an unrepaired cleft lip or cleft palate, which has obviously affected them in society. So for me to be able to go over there, to be able to perform a surgery that I'd been taught over the last decade to do, and to be able to then give this boy a chance at adjusting into normality was a wondrous thing to be able to shape him. And not only shape him from a functional standpoint, but also from an aesthetic standpoint as well. So the psychological impact of these surgeries cannot be underestimated. This is an actual image from a patient I repaired back in the US who underwent a car crash. And you can see this is actually a 3D reconstitution of a CT scan. So when patients go into a CT scanner, we can create 3D models of their face to be able to plan surgery. Now, as you can see, if you look in the top left-hand corner, you can see above that orbit that it's smashed. It doesn't look like the right side. So that bone's caved in, the whole orbit is affected, and their vision can be compromised in some situations. This unlucky gentleman was in a car crash, and so obviously it's our role as plastic and reconstructive surgeons to then see what the damage has been done and create a meticulous plan to be able to get them on the road to recovery. Not only, again, from a functional standpoint, for his vision to be intact, for him to be able to see normally, so his eye isn't sunken in, but also from an aesthetic standpoint, because it makes a huge difference if somebody hasn't been reconstructed in an effective way. I saw things from gunshot wounds to the face, I saw bear attacks, I saw motorcycle accidents, I saw a deer, a deer antlers through somebody's chest. I've seen literally everything you can imagine. But when I took care of patients who, for example, there were suicide attempts where they would use a shotgun and try and blow up their face. And when you see them come into A&E, or what we call the ER in America, they're unrecognizable. You can't tell what's what, you can't see what's what. You have to temporize them, you have to stabilize them, you have to get them into the scanner, and you have to see how you can reshape and rebuild these people's lives. Again, not only from an aesthetic standpoint, but also from a functional one. For them to be able to eat, to see, to breathe properly, and then also to be able to walk out into society, for people not to be alarmed, or for the stigma again to be there because they haven't had an adequate reconstruction. So a lot of these things that I saw were mind-blowing to me, and I think when you look at it, I'd always wonder, I'd stand in A&E with somebody who had tried to commit suicide, and it had missed the brain, the bullet had missed the brain, but they had blown up their face. And when we got them to the point, 2 months later when they're about to discharge after a lot of therapy, and you saw them look like normal individuals, like people that you would know, and they get back to their family, that was wondrous. So as you can see, this is clearly a before and after, and if people can notice, really this work has been done on the jawline. So if you look at the before to the left of your screen, you can see a patient who hasn't got necessarily a very defined jawline. Now, a lot of people walk around with that every day, but it bothered her. And what the issue that I see being a practitioner who does a lot of aesthetic work now in my practice is people see this as vanity. People look at this and say, why would you go to a plastic surgeon's office and go and get this procedure done just to make yourself look better? But what people are not seeing is the psychological impact of these treatments. Patients walk into my office, and it could be a life circumstance that they went through. It could be their partner cheated on them and had an affair. It could be that they recently got divorced. Surgical, it's non-invasive, it's very simple for me to do, because you've seen some of the work that I've done previously. However, as doctors and as surgeons, you don't always need to do the most invasive form of treatment to make patients feel good about themselves. This is about confidence. We all embrace self-care in our daily life, whether we go for a haircut, we get our nails done. When my patients come back to me and say, I was finally able to have photos taken at my son's wedding, or I was finally able to look in the mirror without feeling upset and getting emotional, that for me is everything as a provider. That's all I would ever want my patients to feel. More confident, to be able to walk into society and feel more confident about themselves. So I think there's a lot of judgment in society, and still stigma to this day, about aesthetic treatment. People also judge providers who do aesthetic treatments because they think people always say to me, you're a plastic and reconstructive surgeon, you've done things all around the world and done these global, huge reconstructive surgeries. And I say, yes, I have. But at the same time, as a doctor, my goal is to make people feel happy. And if patients feel happy, then I feel happy. And that means I've done my job for them. My patient says, I have an extra spring in my step. I've been able to regain my confidence. I could go for that job that I wanted to. And if you look at recent scientific studies that look at the impact of cosmetic or aesthetic treatments on people's mood, there have been recent studies to show that even Botox has the effects of being able to suppress the depressive symptoms and actually statistically significantly improve depressive symptoms after having these treatments. So it can be as simple as these procedures that are done every day in clinics all over the world that can make a huge impact on people's mood and how they feel about themselves. So it doesn't always have to be the most complex that gives the satisfaction and reward. It can also be the small procedures. Now when people look at this, they may see me, it is me, operating and doing a very complex surgery at the time. I'm wearing my magnifying loupes to be able to see things in more detail, and people must look at this and say, this shows that he's focused, he's determined. He is paying so much attention to that patient who's lying on the operating table in front of him. But there's much more to a picture, as you all know. When you look at this photo, I was going through a lot in training. Burnout, exhaustion, fatigue. These are all the things that I felt during all the years in training. Working 110 hours a week, doing 100 hours on call straight without sleep. This is the life that I was living. I was exhausted in this picture. I was absolutely exhausted. I felt burnt out. I was losing my passion over the years because it's very hard to sustain that pace of life, not only from a physical standpoint, but more importantly, a mental standpoint. People always forget that doctors and surgeons are humans. We're as much human as anyone sitting in this audience, but people forget that, and we're expected to show up at our jobs and perform at 110% for that patient who's lying in front of us on the operating room table. And don't get me wrong, I am 110% when a patient is lying in front of me, but it doesn't mean to say that there's so much going on behind the scenes and in my mind. So this was a time where I was extremely exhausted, I was fatigued, and I was very, very burnt out. And I've taken a long time, it took me 2 years after I finished my training and became a plastic surgery consultant, to actually reshape my own mind to be able to get to the place where I can help others even better. It really took me those couple of years to really reflect, to be able to take time for myself and my family. I took a little bit of time out. I needed that time to heal from the trauma of training, to heal from the negative and toxic work environments that we endured in America. I went through workplace bullying, I went through toxicity, I went through extreme work hours, pushing myself to the point where it wasn't then about actually thriving, it was about just survival and getting through each day and each week. So when you look at this picture, remember that behind it all, there is so much of the mental wellness and mental well-being component that is so easily forgotten in our medical and surgical communities and in a lot of industries across this world. But we need to take the time for ourselves to reshape ourselves to then be able to help reshape others in a more effective way. Yes, maybe. But also, this photo means so much to me because it's after all that time, all that training, and the literal blood, sweat, and tears that I poured into this profession, I'm finally at the point where I'm happy. I'm happy on the inside and on the outside. This isn't just one of those operating photos where people look and say, this guy's focused, what a life, it's incredible. This is the first point in the last decade that I've truly felt happy. I felt that I finally reached a point that everything that I went through was finally worth it. And it's important for us all to remember that you have to help yourself before you can truly, and at 110%, be the best version for other people. And I wanted to be the best version of myself to then be the best version for others. I really thank you for the honor and for your time today.
As part of the experience, breakfast, lunch and a glass of Prosecco were included for those who attended. With new and engaging presentation already in the works, we hope TEDx events return in the near future. This is Julia Finnegan reporting for the University of Buckingham.